At 2 a.m., a resident walks to the bathroom. A caregiver steps in to help. From the hallway, the event looks entirely routine. While one bathroom trip is manageable, 3 trips a night, multiplied across dozens of residents, creates a systemic strain on the facility's night shift. In clinical terms, waking at night to urinate is called nocturia. Looking past the bladder reveals a wider network of health indicators. Frequent nocturia can be a systemic indicator. It connects directly to cardiovascular health, daytime fluid regulation, blood pressure rhythms, and kidney function. To manage this, senior care leadership can shift away from accepting these nighttime disruptions as inevitable and start measuring them as actionable data. Understanding this 2 a.m. pattern is essential for clinical executives. It is a measurable precursor to resident decline and a significant contributor to nighttime workflow stress. Think about the resident during the day. Older adults often sit for long hours, navigating the challenges of limited mobility or chronic cardiovascular concerns. This diagram illustrates how, over the course of the day, gravity pulls fluid downward. In many residents, that fluid accumulates and pools in the lower legs. The dynamics change the moment that resident goes to bed. When they lie flat, gravity no longer traps that fluid in the lower extremities, allowing it to shift back toward the heart. That upward shift increases central heart pressure. To compensate, the body signals the kidneys to filter sodium and water out of the bloodstream more aggressively. The kidneys route that newly filtered fluid downward, overproducing urine in the middle of the night. This shift is what forces the resident awake. That 2 a.m. bathroom trip is often the biomechanical consequence of daytime fluid dynamics resolving themselves while the resident rests. When internal biology forces a resident out of bed, the impact moves from the individual to the entire care facility. Navigating a dark room while groggy increases fall exposure, and frequent waking prevents the resident from cycling through deep, restorative sleep. The burden then transfers to the care staff. Interruptions overload the call-light system, pulling caregivers away from essential tasks. The consequences continue the next day. The resident wakes with morning fatigue, increasing dizziness, and family concern. Addressing this strain starts with tracking the disruption, just like any other vital sign. A structured 7-night log allows staff to map trip frequency, timing, and morning energy levels. Unchecked fluid shifts manifest as facility-wide operational challenges. For care directors, rigorous daily measurement provides the data needed to manage these risks effectively. Tracking a full week of data allows care teams to look at the bigger picture. You move from reacting to isolated bathroom events to analyzing a cohesive nighttime pattern. To interpret these broader systemic patterns, traditional Chinese medicine offers a complementary whole pattern lens for observation. This traditional framework looks at the kidney system, a network used to describe water regulation, physical warmth, and aging. The value of this approach is practical. It encourages care teams to look beyond a single symptom and evaluate the resident's overall endurance and physical reserve. Combining modern operational tracking with a holistic framework helps directors understand the resident's needs at a deeper level. Once the nighttime pattern is successfully mapped, the team can decide on the appropriate supportive routine. The Kidney Vitality Herbal Pouch is an external TCM-based supportive routine designed for nighttime urination and broken sleep. Its profile is non-invasive. The application is completely external. There are no swallowed pills, no teas to drink before bed, and no injections. This intervention was evaluated in a retrospective observational case series involving 17 patients. This chart reflects the findings. For these patients, the average nighttime bathroom episodes dropped from a baseline of 3.9 to 1.1. These are observational findings, not randomized trial proof, and independent validation is still needed. But the operational insight is clear. Nocturia belongs on the same dashboard as falls and wandering. Making the 2 a.m. pattern visible allows care teams to better support the resident and proactively manage the operational burden. Measure the pattern, support the person, reduce the burden.